Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
So I'm going to share an easier question, I think. I asked my provider who told me that liquid biopsy was not FDA approved and therefore was not available to me. Is this a test I can insist upon having versus in addition to my regular scans? So I guess this is a question. So I'm sorry, I was reading this in real time. So there's, I guess, two parts to this question. The approval level of liquid testing and whether, I guess, how standard of care it is for monitoring in addition to scans.
Well, I'll say that there are at least two FDA approved, commercially available next generation sequencing liquid biopsy tests. So that deals with FDA approval. Now, as I mentioned, current clinical applications are really like at diagnosis to facilitate broad genotyping in patients as well as at disease progression on targeted therapies. Now, like whether you can use it for monitoring and at different time points, that's usually a discussion about the insurance provider and whether different providers may cover the cost of the assay. So that's kind of a broader a broader discussion with like what will the insurance cover usage in that circumstance.
And I think there's more likely to be coverage, at least in my experience, for when you're making a switch in therapies. I think kind of using it throughout a therapy when something is working might be a little bit of a tougher indication for it. But I agree. There are approved liquid biopsy assays that are readily available, and this should be covered. But I think that how to put it in using a liquid biopsy in practice when it's not a diagnosis or one of those key time points is a little bit more of a gray area.
So we've had a number of questions about payment, so I'm going to come back to it. This one is currently, does insurance, in my case, Medicare, cover all or part of the cost of a liquid biopsy? So doctors tend to be awful at understanding cost for patients, and it's not entirely our fault, right? For years when I made this comment, I've implicated us and said I have intent to learn more, but I've actually tried over the years. And cost of care is really opaque, even to the people who study cost of care. For a living. There are complex statements, and it's not at all straightforward to find out what is X going to cost the way it is. Like if you go into a candy store and say, what is this chocolate bar going to cost? It's really, really opaque. In general, insurance does cover the cost of molecular testing at least once in non-squamous stage 4 disease, and now in non-squamous pretty much any stage disease. The harder part is if you already have a diagnosis, whether they're going to pay for more. So certainly if you get liquid and it doesn't give the answer, can you follow up with tissue, a la the strategy Dr. Thompson described? The simple answer to that is yes, all major payers will allow that. Not all payers will allow more than one test. So if you get liquid, then you do tissue anyway. You get liquid and it has an answer, I should say, and you do tissue anyway. Can there be a problem? Yes. If you try to do sequential testing, can there be a problem? Yes. There are answers to this. So one is that you should ask to speak to a financial counselor. The other is that if you have a nurse navigator, social worker, who's ever helping coordinate these things for you, there's somebody who can help you to apply a priori before the test is ever ordered for financial assistance. And most of the companies have arrangements where either your insurance will pay or you'll get some kind of financial assistance as long as you do it in advance. And so it's worth asking whoever the right person on your care team is in advance, can you help me with whatever assistance is available so that I can get this best available testing but not be landed with some massive bill.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelexis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.